Let's follow the medical assistant as she extracts medication into a syringe using several techniques.
When ordered to withdraw medication from a vial for administration, you should begin by washing your hands. Next, select the appropriate vial of medication and prevent error by verifying it against the physician's order for the 6 rights. Select the appropriate syringe and the appropriate gauge and length needle. Clean the rubber top of the vial with an alcohol pad. Use a circular motion starting at the center and working outward. Open the syringe and needle. Be careful not to contaminate the items when opening. Loosen the barrel of the syringe by gently pulling the plunger back and forth. While holding the syringe at eye level, pull the plunger back to fill it with air to the desired volume of medication. Being careful not to contaminate, unwrap the needle and attach the needle to the syringe. Uncap the needle and lay the cap on a clean surface. Place the needle in the center of the vial and inject the air slowly. Injecting quickly may result in air bubbles that can affect the accuracy of the withdrawn dose. Invert the vial and raise it to eye level. Slowly, using gentle negative pressure, withdraw the medication. Keep the needle tip in the liquid to prevent it from drawing in air. When the appropriate dose has been reached by volume, slowly withdraw the needle from the vial. Gently flick the syringe to remove any air bubbles. To keep the needle sterile, follow your institutional policy when recapping needles. MA tip. Some medication manufacturers suggest that the needle be changed between the vial and patient. Inserting the needle through the vial dulls the needle, and some substances are irritating to the tissue. Changing the needle will result in less local reactions. Check your institution's policy. Place syringe, cotton balls, alcohol pad, and adhesive bandage onto a medication tray. Label wrapper if necessary with the appropriate information. Recheck the medication against the chart before disposing or returning to the storage area. Dispose of waste in the single-dose vial according to facility procedure. If using a multiple-dose vial, return it to its proper storage area. Finish by washing your hands. MA tip. To prevent medication and documentation errors, label the syringe wrapper with the name of the drug, dose, manufacturer's name, lot number, and expiration date. Slide the syringe back in the wrapper and place it on the tray. When drawing up medication from 2 vials for administration, you should begin by washing your hands. Then, select the appropriate vials and prevent error by verifying them against the physician's order for the 6 rights. Determine the route the medication will be delivered to ascertain what size syringe and needle will be needed. Determine the order that the medications will be drawn into the syringe. The usual standard is to draw up clearer or lighter medications first, and then darker or cloudy medications second. But check the medication insert or with the physician for further clarification. Calculate the dosages for each medication order. Add both dosages together. This will determine how far you pull the plunger back when withdrawing medication from the second vial. Swab the top of each vial with alcohol. Open the syringe and loosen the barrel. Draw air into the syringe equal to the amount of medication to be drawn up from the second vial. Unwrap the needle and place the needle on the syringe. Remove the cap from the needle, being very careful not to stick yourself or contaminate the needle. Place the cap on a clean surface. Inject the air into the second vial and remove the syringe and needle from the vial. Make sure the needle does not touch the liquid. Next, draw air into the syringe equal to the amount of medication to be drawn up from the first vial. Inject air into the first vial, then invert the vial. Gently pull back the plunger until you reach the desired amount. Remove the syringe and recap the needle according to institutional policy. Flick the needle to remove air bubbles. Change your needle. This will help to reduce the risk of medication from the first vial mixing it into the second vial. Insert the new needle into the second vial. Invert the vial and gently withdraw the medication from the second vial to the volume in milliliters equal to the total of both medications added together. Remove the syringe from the vial and follow the institutional policy regarding the recapping of needles. Remove any air bubbles by gently flicking the syringe and change the needle if appropriate. Place the syringe, cotton balls, alcohol pad, and adhesive bandage onto a medication tray. Recheck that you have the correct medication one more time prior to returning the vials. Label the wrapper if necessary with the appropriate information. Dispose of your trash. Finish by washing your hands. When ordered to reconstitute powdered medication for administration, you should begin by washing your hands. Select the appropriate diluent and powdered medication vial and prevent error by verifying it against the physician's order for the 6 rights. It is very important that the medication and diluent are compatible and will not form a precipitate. Check medication order for specific instructions. Determine the route the medication will be delivered to ascertain what size syringe and needle will be needed. Remember, you will need a separate syringe to draw up the diluent and to draw up the mixed medication. Swab the top of each vial with alcohol. MA tip: you do not have to wipe with an alcohol swab when opening a brand new vial. The top of the vial is already sterile. Open the syringe and loosen the barrel by gently moving the plunger back and forth. Holding the syringe at eye level, withdraw an amount of air equal to the amount of diluent to be withdrawn. Open the needle and attach it to the syringe. Uncap the needle and place it on a clean surface. Insert the needle into the vial and slowly inject the air. Invert the vial and hold it at eye level as you pull out the plunger and withdraw the appropriate amount of diluent. Transfer the diluent into the powdered medication vial. Remove the needle and syringe and discard into a sharps container. Roll the vial between the palms of your hands to mix. Label the vial dilution of the medication with the date, time, your initials, and the expiration date. Clean the mixed vial with an alcohol swab. Assemble the syringe and needle according to institutional policy. Withdraw the desired amount of medication using the technique demonstrated previously. Recap the needle and flick the syringe to remove any air bubbles and place the syringe, cotton balls, alcohol pad, and adhesive bandage onto a medication tray. Check the medication against the physician's order before returning it to the appropriate storage area. Label the wrapper if necessary with the appropriate information. Return the diluent to its proper storage area. Dispose of the trash. Finish by washing your hands. When ordered to withdraw medication from an ampule for administration, you should begin by washing your hands. Check the physician's order. Select the appropriate ampule and prevent error by verifying it against the physician's order for the 6 rights. Determine the route the medication will be delivered to ascertain what size syringe and needle will be needed. Then select a filter needle that will trap any glass fragments when withdrawing the medication from the glass ampule. Put aside a sterile gauze pad to use to prevent you from being cut on the jagged edge of the broken ampule. Open the syringe and attach the filter needle. Place it down on a clean surface. Check the ampule for the location of the medication. If the medication is trapped in the top of the ampule, flick the neck repeatedly with your fingernail while holding the ampule upright to move the medication into the body. Remove the sterile gauze, touching only one side, and wrap it around the neck of the ampule and snap off the top at the neck in an outward motion. Dispose of the top in the sharps container. Remove the needle cap and hold and tilt the ampule slightly with your non-dominant hand. Insert the filter needle below the level of the liquid and gently draw the liquid into the syringe, tilting the ampule as needed to access the liquid. After drawing up the medication, remove the filter needle and place the ampule on the counter. Push the medication to the top of the syringe and place the cap on the filter needle and flick away any air bubbles. Remove the filter needle and replace it with the capped injection needle and place it on the medication tray. To prevent documentation and medication errors, check the ampule against the physician's order, then dispose of the ampule in the sharps container. Set up a cotton ball, alcohol pad, and adhesive bandage. Label the syringe wrapper with the name of the drug, dose, manufacturer's name, lot number, and expiration date. Dispose of your trash and wash your hands. Pick up the medication tray and leave.
Now that you've seen how medications are prepared, let's look at the procedures for administering parenteral medications.
MA tip. Standard precautions and personal protective equipment are integral to the safety of you and your patient. Many needles today feature safety mechanisms that cover the needle after the injection has been given. Safety needles help protect against accidental needle sticks.